And the dosage, it is 0.001. It is just only 1 to 2 drops here. And it is done once for all. And when vaccinating against malaxy, my viewers who are viewing now, we combine 4 vaccines. The first one is malaxy. The second is Newcastle, Lasota or plain. The third is IB1 and Gomboro 1. Are all mixed and combined in one vial of malaxy. So when you vaccinate on day 1, even if my farmer who is deep in the village there have no access to vaccines, honestly speaking, will not be affected. Why? We have vaccinated them using injectable intramuscular. My viewers, I'm Luigare. After hearing and listening to the farmers complaining about the death of chicks due to vaccination program and vaccination problems and challenges, that's why he's here. Now, if it comes to vaccinating Newcastle, my viewers, stop vaccinating on the eyes. This is the way how you need to handle the syringe, not in this format. Most of you who are viewing, you handle the vaccine like this and you start vaccinating. It is just drops. But you start vaccinating when this vaccine is damaged and spoiled. The way how we handle the vaccine, it is in this format. My viewers, don't allow this vaccine here to be connected with your thumb here. This is how we handle. And if it is vaccinating in Newcastle, IB1 or Gomboro, this is the way how we handle the chicks. In this format, you can see just drops. They have to be not less than 2 drops. But even if you give it 5 to 10 drops, have no overdose, neither damages. I'm talking about the oral vaccinations. If we are vaccinating against avian flu or treating, it is just the drops in the nostrils here, as you see. Avoid vaccinating any vaccination in the eyes because the tears are salty or acidic. It's like when we vaccinate, don't use tapped water. They have chlorine, meaning the national water and the sewerage corporation. Never use that when you are vaccinating your chicks. They contain chlorine. The vaccine is not going to work. Now, once you use this chemical vaccine, make sure there is temperature in the room, because the vaccines you are using for vaccinating is from ice. they are going to get that coldness, even like you. If you take a cold water from the refrigerator, the body temperature will decrease. So the chicks will need the pots inside there for rewarming the room. If we are vaccinating using the chemical medicine, this one here, at day 1, we combine Malex, Newcastle plain, IB1, and Gombolo. Administration injectable. Dosage 0.001 mml. We repeat this at 14 days. And if we are to be revaccinating, the second administration of the vaccine for the chicks got from our offices, we advise you to combine still 3 vaccines: Newcastle, IB, and Gombolo. The reason why we frequent Newcastle, this is the #1 killer disease of chicken. But you people, you have a poem of day 1 Malex, 7 days Newcastle. Who told you that Newcastle can affect your chicks after 7 days? In the transit here, you may come across an environment where there is an outbreak of Newcastle. This is the reason why at day 1, Newcastle have to be vaccinated. When they reach home, you can revaccinate them only Newcastle, IB, and Gombolo. Revaccinate at 14 days. Day 1, 14 days and 28 days. Meaning in a month, we vaccinate 3 times. The dominant is in Newcastle. It has no side effect that whenever you are vaccinating, you combine the 3. Newcastle, IB, Gombolo, Newcastle, IB, Gombolo, Newcastle, IB, Gombolo, finish. Then at 6 weeks, that's when you vaccinate for pox. But even at day 1, you can combine that for pox vaccine in the 4, such that even if you don't vaccinate at 6 weeks, you will not be affected. If we are to be vaccinating against pox, we vaccinate at the wings here. At 6 weeks, the vaccination takes place at the wings, which we call the follicle wing, only once. The sign and symptom of pox is swelling of the eyes, having wounds on the nose here, having wounds on the mouth, and air space or air sac, like the balloons. My viewers, it is of my own interest to see that we share this, whoever is viewing. I would kindly request, if at all we have leaders who are genuine and passionate, we could be supported and sponsored, such that we conduct these workshops at the grassroots, where we have these farmers, but simply because we have enough supporters and we present on the TV shows. But how many people have these TV sets in their homes? And if we are to promote and support the lay people on the grassroots, My mom, who is in Luigre missing there, my granny, who doesn't have a TV and would desire to rear chicks, where is she going to acquire this knowledge? Whoever is viewing, and you have access to these people with authority and funds, let them come out and support us. What we need are three. One, mobilization of the community. Two, accommodation in terms of the venue where we are going to train from. Three, facilitation in transport means. It is you to decide to thank us or not to thank us, because we don't care. I told you before, my conversations and training are honest but uncomfortable. Whoever is viewing, if I may ask whoever is viewing at the sub-county level, the division level, where, when, and how do these veterinary officers at the sub-county provide services? When, where, and at what time do these agriculture extension officers at the sub-counties provide services, yet are fully facilitated? They have motorcycles at the sub-county levels, but have neglected and abandoned their work. These are not service providers. They are salary earners. However much the government and Mr. Museveni complains about service provision, honestly speaking, corruption is not all embezzling the funds, but it is duty negligence. If this is sorted out, every district have veterinary officers. Every district have district agriculture officers. They have new vehicles, but there is no at any one district which I have ever seen an agriculture officer conducting a workshop to the farmers, yet they are paid. The cow gives them fuel, but where do they do? When and how? This is the biggest challenge. The civil servants, which have created to hate this government because of duty negligence, illegal redress, corruption and embezzlement. I'm Luigare Isa Vaccination.